Tell us why it's important to strengthen one's immune system as a defense against COVID-19. How does a strong body actually fight off the virus?
Yeah, before anything else, the immune system is responsible for taking care of toxins, infections, as well as tumors. So it's really important to pay attention to the health of our immune system. Otherwise, we could get sick easily. And before that, our immune system is divided into two main parts. One is called the innate immune system, which is something that we're born with. And basically, this is non-specific and can take care of any microbes that we first encounter. The other part of the immune system is called the adaptive immune system, which is actually something that develops after we're born. This takes place or becomes active when we're exposed to microorganisms. Basically, our cells would produce antibodies, and
Mhm.
this is the principle behind a vaccination.
So, can you actually tell us what are the natural ways to maintain good health?
Sure. So definitely it goes back to the basics, things that we sometimes take for granted, such as, for instance, a healthy diet. We recommend an anti-inflammatory diet, which is primarily vegetables and fruits, as well as nuts, because again, one of the causes of aging is chronic inflammation. And one thing that happens when you have severe COVID infection is that you have a lot of inflammation or what we call a cytokine storm.
Hmm.
So basically, the immune system starts to fight not only against the infection, but also causes damage to our cells, to our normal cells. So it's really important to pay attention to a healthy diet. And of course, other things like getting fresh air, because like if we spend a lot of time indoors, it actually is more what do you call this, more polluted. There's more indoor air pollution compared to outdoor air pollution, and this is because of the use of a lot of, let's say, um, pesticides or um, cleaners or artificial fragrances. Of course, the dust as well as mold could also affect our breathing. So it's
Mhm.
important to get some fresh air and, of course, exposure to sunlight, which is a good source of vitamin D3. Um, it's really important to go outdoors to get some vitamin D, because if you like spend time or just wait by the window, the ultraviolet B rays does not penetrate through
Mm.
the glass. So it's really important to go out there and get some ultraviolet B light or rays from the sun. Then, of course, hydration and exercise. And of course, I can't overemphasize the importance of sleep, at least 7 to 8 hours of sleep, because when we sleep, we actually produce hormones that are important for regeneration and repair. This include melatonin, which most people think are it's just for jet lag, but it's actually a good nutrient to take to prevent brain aging. So to prevent dementia eventually, we need to take antioxidants that actually penetrate the blood-brain barrier. And of course, it's also good for the immune system. So some people use it or recommend it as part of the wellness or as part of the anti-COVID program, because melatonin in high doses would actually help strengthen the immune system as well. So these are the basic things that we could do at home to basically strengthen our immune system. Then, of course, there are the supplements. Supplements like vitamin C, D3, zinc, and a bioflavonoid called quercetin. These are all good against COVID and other viral infections.
Would you say, I'm trying to memorize everything you
Yeah.
said,
Yeah.
obviously a healthy diet, you
Mhm.
have to have 7 to 8 hours of sleep. You need to work out. You
Yeah.
need to go outdoors. You need to hydrate.
Yeah.
And everything else you mentioned, are these actually enough to prevent you from catching the virus?
Actually, when we age, our innate immune system begins to decline. That's why ang tinatamaan are those people who are elderly or those who have comorbidities. So what we really need to take care of is our innate immune system. And things that would help improve our innate immune system include vitamin C. So vitamin C is not just an antioxidant, it's actually helpful for improving your immune system because it helps your white blood cells, especially your natural killer cells. It helps with the growth and activity of this, what we call antigen presenting cells.
But how do we know where we are deficient?
Yeah, so that's a very good question. Actually, based on regular blood tests, we can see how our immune system is. Like for instance, yung blood count, CBC, when we
Mm.
have a low white blood cell count, it could mean that our immune system could be low. However, sometimes we may have normal white blood cells, but when you look at it under the microscope, we call it a dark field microscope, the activity of the white blood cells may be slow. So this white blood cells could be sluggish. And one thing that could affect that is if you have a lot of sugar in your diet, it actually slows down the immune system.
Yeah, they say that's one of the culprits, sugar.
Yeah.
Sugar is really not good for the body. But so because we would have deficiencies, such as, nutritional deficiencies, because we don't get enough sleep, we don't eat enough fruits or vegetables. What among the deficiencies in our body can actually make us susceptible to the virus?
Yeah, there are certain nutrients that are affecting our immune system when it's low. Like for instance, your zinc levels. Zinc is one of the one of the common nutritional deficiencies. So zinc has antiviral properties. So when you're lacking in zinc, you get more susceptible to viral infections. And you probably heard of controversial medications uh, in the news, like for instance, I would mention them like hydroxychloroquine or
Yes.
ivermectin. Yeah, or ivermectin. These are basically, these medications actually need zinc for it to work effectively. So if you take those medications, but you don't take zinc, then it won't be as effective as when you take the uh, medications with nutrients like zinc.
That's so true because, a number of chats or even from doctors, they'll say, take C, take
Yeah,
and take zinc.
yeah,
But how do we actually know if is there such a thing rather as an overdose to these supplements?
yeah, definitely. So it's about being in balance. In Chinese medicine, we call it yin yang. So if things are out of balance, let's say you get too much of vitamin D, it could actually cause problems. We're more worried with the fat soluble vitamins because they tend to accumulate in the body. So these are vitamins A, D, E, and K. The fat soluble ones do not tend to accumulate in the body. These are vitamin C and the B complexes.
I see. Okay. So could there be treatments that can help boost one's immune system?
Yeah, definitely. So orally, you could take these supplements, but you need to take the optimal doses because if you take it in low doses, it may not work as well. Like for instance, the required daily allowance of vitamin C, I think is only like 200 milligrams, which is actually nothing. Maybe during the 1900s, it would have worked. But nowadays, because of too much stress, this is from it could be psychological or physical stress. We definitely need more of vitamins nowadays. So with vitamin C, we recommend at least 3,000 milligrams in divided doses per day as a preventive. But there are people who actually do take more as long as they don't develop side effects such as like diarrhea if you get too much of the C. Then yeah.
Okay, tell us more about preventive medicine. What is the, let's call it the Joel Lopez approach to the brand of holistic wellness?
Yeah, well, preventive medicine is basically more proactive medicine. So basically, you're trying to get things or diagnose things before you even see it on a, let's say, on a mammogram or a chest X-ray. So basically, we do what we call functional testing. Through this functional testing, we're able to find out imbalances that long term could cause problems. Like, for instance, if a person has mercury toxicity, we could only find that out if we actually test for it. But people who have mercury toxicity may eventually manifest with symptoms similar to multiple sclerosis, or people could also experience hypertension from too much mercury. So these are things that we actually look into. We want to be proactive. We want to prevent people from getting sick in the first place. And then, of course, we want people to feel at their optimum, not just physically, but also mentally, and other aspects of life.
But how does it actually begin? Does it begin with a blood test?
Yeah, good question, Pinky. In our clinic, we have these four pillars of health. It begins with number one, early detection or diagnosis. So before we do any type of treatment, we have to check if the patient has any imbalances. Like, for instance, if they have nutritional deficiencies, if they have hormonal imbalance, or if they have toxicities. And we also check the function of their nervous system. So, of course, we do regular testing like your CBC or blood chem, but we also do check for other things that are not normally tested by conventional doctors.
Tell us, how do wellness treatments actually provide lasting effects against the virus?
Yeah, actually, this is something that we need to work on proactively as well as sustainably. Let's say one IV treatment alone won't take care of our immune system. So it's usually a series of treatments because, like, for instance, if a person has a magnesium deficiency, diagnosed through the blood, uh, it may take a year to correct this magnesium deficiency if you just take oral magnesium. Whereas if you correct this magnesium deficiency through the IV, through IV drips, you're able to correct this much sooner.
So now I take it, Dr. Joel, that even if they say, drink these supplements,
Mhm.
you might not actually be taking the right amount, or you might be taking supplements that you don't need.
That's true. Actually, there was a study in the States. It's from the Consumer Reports magazine. They actually found out that 75% of supplements sold, like in at Walgreens or Costco in the States, actually a lot of them didn't have the right amount of nutrients that was stated in their labels, or sometimes it just was just full of binders and fillers. So we really need to check out, do our due diligence, make sure that we're getting the right nutrients from our supplements.
We should be very mindful of that.
Yes, definitely. We really need to read the labels when we buy our supplements.
Yeah, but that's a little hard for people like me,
Yeah,
because I can read the label and I can just believe it, or I might not even understand it much.
yeah, that's true. So sometimes you just have to ask your wellness doctor what
Right.
brands would they would recommend.
Well, so that's step one.
Hmm.
Ask your wellness doctor to check you,
Yeah.
to see if you're actually taking the right supplements,
Hmm.
to find out if you're possibly overdosing a
Hmm.
supplement, or you're not taking enough of a particular supplement. So that's very important.
Yeah.
Tell us, what wellness procedures does your clinic offer?
Yeah, so after the initial pillar of early detection or diagnosis, we do something called detoxification, because a lot of the symptoms that we experience as we age could just be due to the buildup of toxins in the body. So sometimes doing detoxification procedures such as, for instance, colonics. People go
Yes.
to the farm in San Benito to do their colonics. Sometimes that alone could help get rid of some of the chronic symptoms that people experience, like sometimes weight issues could be due to toxicity buildup here in the abdominal area, and also skin problems. Like when I turned 40, I had a lot of like adult acne. So I didn't want to take antibiotics, so I just had a series of colonics, and it actually cleared up my skin. Yeah.
What
So
would you so okay, anything else? What else do you offer in your clinic?
yeah, we also have something called infrared phototherapy or sauna. So basically, you sweat out the toxins through the skin. So this would be good for those people who don't want to do IV detoxification treatments, because we have certain IVs that we use for heavy metal toxicity. It's actually called chelation therapy. It's been around for ages, but it's being used for basically detoxification of metals like lead, mercury, aluminum, and all that, which we get from our environment, from our food, air, and water.
What would you recommend for us, especially during a virus outbreak?
Yeah, during a virus outbreak, we would recommend, of course, to take care of your innate immune system by taking enough of the nutrients that we normally recommend. And these are, of course, vitamin C, which is not only an antioxidant, but an anti-infective as well. Vitamin D3, it actually helps stimulate the production of what we call catalycidins or antimicrobial peptides. So that's why during the winter months, a lot of people get sick
Right.
because there's no exposure to vitamin D. The equivalent of winter in the States would be the rainy season here in the Philippines. So that's why the incidence of, for instance, dengue is high during the rainy season, and possibly COVID. There might be a resurgence during the winter months or the rainy months, rather. Uh, so it's important to optimize your vitamin D levels, your C levels, as well as your zinc levels.
Well, aside from strengthening the immune system, what other health benefits do clients get from these procedures?
Yeah, so when we strengthen the immune system, let's say with vitamin C, vitamin C has other benefits. It's a precursor to collagen. So if you want to maintain like real good skin, like elastic skin, you want to make sure that you get enough vitamin C, because vitamin C is used in the production of collagen in the body. But of course, you could take collagen as well. There are a lot
Hmm.
of sources of collagen now. Vitamin C is also good for cardiovascular health. Um, and then, of course, nutrients such as vitamin D is also good for your bones. It's good for your immune system. And zinc is involved in like 300 processes, enzymatic processes in the body.
Can we talk about your wellness procedure for hypertension? What
Oh,
does it do? And how did it actually help your patients recover from this particular ailment?
oh, sure. Sorry about that. Um, so for hypertension, one thing that we need to know is that hypertension is just a symptom. It's not an illness. So hypertension is caused by underlying causes, such as, for instance, stress could raise your blood pressure. Deficiencies in certain nutrients, such as magnesium or potassium, could also raise your blood pressure. When a person has hormonal imbalance, like when they're under a lot of, let's say, um, under a lot of stress or aging, uh,
Yeah,
yeah, aging could also do that because
menopause.
menopause, yeah, yeah, that could do it as well. And in men, it's called andropause. When
Right.
testosterone level goes down, it actually may lead to high blood pressure. And then, of course, heavy metal toxicity from lead or mercury could also cause hypertension. So before we recommend anything, we have to make sure that we find out what the underlying causes are. And when you treat the underlying causes, the symptom goes away.
I see.
Yeah,
I like how you said that it's not an illness, it's a, did you say symptom?
yeah.
Okay, but with this procedure for hypertension,
Mm.
what does it actually do and how did it help your patients recover?
Yeah, for instance, if the underlying cause is stress, then we gotta treat the stress. Um, we may recommend certain what we call adaptogens. Adaptogens are things that would help your adrenal function. For instance, ginseng, rhodiola, ashwagandha, cordyceps mushrooms. These are things that are healthy for your adrenals. So that could help lower blood pressure. If a person has magnesium or potassium deficiency, of course, they may get it from food sources like bananas or green leafy vegetables. But if you want faster results, you want to take the actual supplement. You may take either potassium or magnesium supplements. Then, if the cause is heavy metal toxicity, then we may recommend chelation therapy or infrared sauna for the body to sweat out the toxins. So, yeah, oftentimes it's a combination of things that could cause this symptom. So, that's why when we recommend, let's say, potassium and magnesium, we may also recommend testosterone for a guy or sex hormones for women, but we only use bioidentical or natural plant-based hormones for women. A lot of information.
Pag ginasama tong part na to, ha? But it's so interesting
Yeah, thank you.
because, anyway, I'll talk about it later.
Okay.
So let's move on. Tell us about your weight loss procedure.
Yeah, before we recommend any weight program, of course, we've got to find out what the underlying causes are. And we also do a baseline test for body composition because sometimes there are people who are heavy, but they actually have more muscles, muscles heavier than fat. Then we don't base a person's improvement just based on the weighing scale. We look at their, let's say, the dress size, especially for women. If the dress size goes down, then that means their body composition or body fat percentage is actually declining or decreasing. Um, Weight alone is not a good basis for seeing how a person is improving because sometimes a person loses weight, but they're actually improving their muscle mass.
Right.
So they don't see a change in the scales. However, the dress size or the fit of their clothes actually improves. Then we find out what the underlying causes are. Like, for instance, if a person has a thyroid problem, the thyroid is responsible for metabolism. So if the thyroid slows down, everything slows down.
Yeah.
So people gain weight, they may get constipated, their blood sugar might go up or their cholesterol might go up. So we look at these underlying causes just to make sure that our client gets optimal results.
If it's like the thyroid, no, talk
Yeah,
show either hyper or hypo.
hypo.
Oh,
Yeah,
yeah.
the one that causes weight gain.
Right. Okay. That's the last question. What is your message to the public?
Yeah, my message is for everyone to take charge of their health and work with their healthcare practitioner and engage them in a conversation because a lot of conventional doctors are bookish. They just they're not open to other complementary forms of treatment. When we're in medical school, we're taught this one thing, but when you go into practice, naiiba eh, naiiba. Yeah. So, yeah, just be open-minded and listen to your body because sometimes when we have symptoms, we suppress it, but actually symptoms are our body's way of alerting us that something's going on. So embrace those symptoms and work with your.
Thank you, Dr. Joel.